Hey guys, I'm Kaylee Colby. This is my aneurysm simulation. So an aneurysm is a dilation or bulge of a blood vessel that's caused by disease or weakening of an arterial vessel wall. That most commonly happens in arteries at the base of the brain or in the aorta. So there's a couple different types of aneurysms. So cerebral aneurysms that are in the brain affect 2 to 5% of the population, and they only have about a 33 to 67% survival rate after they rupture. Then abdominal aortic aneurysms, or triple A's, account for 75% of aortic aneurysms, and they affect 4 to 10% of the population over the age of 60 and have a 50%, less than a 50% survival rate after they rupture. And thoracic aortic aneurysms account for only 25% of aortic aneurysms, and they affect 3 to 4% of the population over the age 65, and they only have a 20 to 30% survival rate after they rupture. So risk factors for the different types of aneurysms are pretty similar, with smoking and hypertension being one for both of them. For cerebral aneurysms, age, head injuries, heavy drug and alcohol use, and some specific blood infections are risk factors, and low estrogen levels after women reach menopause. For aortic aneurysms, specific diseases such as Marfan syndrome, tuberculosis, and syphilis can make them more common due to the stress on the arterial walls, a family history of aneurysms, and some sort of blunt trauma. Precautions to take for aneurysms is because men have a higher prevalence of developing an aneurysm than women. Men between the ages of 65 and 75 with a history of smoking have to get screened for triple A's. If you're diagnosed with an aneurysm, steps and precautions to take would be to stop smoking, try and lower your blood pressure, whether that's like eating better, taking some sort of medication, and managing your lipids intake and obesity. Avoid high-intensity activities because this can put stress on the walls of the vessels, which can raise blood pressure, and avoid holding your breath. The effects so exercise has no effect on aneurysms when they're very small, like in their beginning stages, and the dilation is minimal. In some cases, exercise has been associated with triple A dissection or rupture, mostly in people who have Marfan syndrome due to the comorbidities. And exercise can reduce the incidence of aneurysms developing, and in some cases they can limit the growth rate of an aneurysm that's present if you do so carefully and with moderate intensity to ensure not to elevate your blood pressure too much. So some of the appropriate exercises that I'm going to be showing in the simulation are just moderate aerobic exercises, so treadmill, walking with maybe a slight incline, stationary cycling, swimming, light yoga, because these are all activities that are very low stress, low impact, and can improve your cardiovascular health, so it'll help your heart pump more efficiently. Because they're low stress, they don't raise your blood pressure too much, so you don't have to worry about there being an increased pressure on the arterial walls, which could cause the aneurysm to rupture. And while you're doing these exercises, you should be assessing your patient's heart rate and blood pressure throughout the exercise and between each exercise, just to ensure that it stays within a safe range and they're not at a risk for a rupture. So without further ado, let's get into the simulation. So brisk walking, whether it's on a treadmill or outside, improves cardiovascular health and circulation without significantly increasing blood pressure or putting a lot of strain on the heart, which helps reduce the strain on the blood vessels and lowers the risk of having any aneurysm complications. The same thing goes for stationary cycling, which he's going to do next, because it's low impact, so it improves heart and lung function without excessive strain or blood pressure spikes, which is why weightlifting would be contraindicated because it increases blood pressure and intra-abdominal pressure, which puts pressure on the walls of the arteries, which could lead to an aneurysm rupture.